Hello, my name is Jennifer Tennyson. I'm a student at the University of Washington, Tacoma. And my capstone project that I'll be presenting today is on caregiving during the pandemic. Caregivers during COVID-19 pandemic are under increased stress and provided less support. By increasing respite care and making resources known and easily accessible, this will prevent the risk of unintentional elder neglect and prevent caregiver burnout. Pre-pandemic, resources were already scarce for family caregivers, and when COVID-19 closed down some of the resources, it was devastating to many caregivers. The long-term goal is to create easily accessible resources that are flexible to continue in the pandemic and post-pandemic world, such as respite care, access to medical professionals at home that are financially supported by insurance, counseling for caregivers, bath aids, access to medicine, and staff to come show the caregiver how to set up medications properly. This will help prevent caregiver burnout and lower the risk of unintentional elder neglect. Pre-COVID, caregivers spent an average of 22 hours a week providing assistance. Since COVID, caregivers are more falls on caregivers' shoulders as their responsibility, because elders are the ones who are at higher risk of COVID-19. So they are in isolation and they are unable to go and live their lives outside their homes because they're on lockdown and taking safety precautions. And caregivers have to take those safety precautions as well. So they are doing more work with extra precautions. And many caregivers report that they were not prepared for becoming caregivers. 85% report needing more information. 44% would like more information on how to manage stress. And this was before the pandemic. And caregivers with children are reporting higher levels of depression and anxiety. Now, caregivers of older adults who ordinarily deal with stress and systematic lack of support in the United States are now facing even more burdens, which are known to increase caregiver risk of being abusive or neglectful. Caregivers also have an increased amount of responsibility that put more strain on them on their already busy schedules. Isolation and concerns about health can lead to increased depression and anxiety. For my intervention, this project is working with the solutions-based theory. Social workers and caregivers will be identifying the barriers and needs of the clients and utilizing resources that are easily accessible to address the needs to assist in decreasing stress and providing quality care to the caregiver and their care recipient. The initial introduction will be proposed to supervisors of social workers in hospitals, hospice, and in adult protective services. The resource list will also be shared on social media pages for caregivers to find themselves. For the outcomes and the outcome indicators, outcome number 1 is increased knowledge of healthcare resources for disabled. This will be measured by a questionnaire before and after an educational class and provided resource list. Questionnaire will include questions about resources in their area, qualifications for Medicaid, Medicare, how to apply for disability services offered by home health and in-home caregivers. Indicator 1 or indicator A, known health conditions associated with aging. Criteria to achieve indicator A, increased number of answers to questionnaire after provided a list of resources specified for their previous deficiencies. Indicator B, knows rights and responsibilities of a senior patient for health management. Criteria to achieve indicator B, increased number of answers to questionnaire. Questionnaire will include questions about rights of a senior patient and their caregiver Also questions about power of attorney and guardian roles. Outcome number 2, reduction in barriers to assistance. This will be measured by questionnaire addressing barriers and provided resource list. Potential barriers are transportation, access to medical supplies, access to sanitary items, respite care, and access to medication. Indicator A, overcome transportation barriers criteria to achieve indicator A. Clients are meeting needs and lists of barriers decreased. Indicator B, provisions of information and referrals meet clients' needs. Criteria to achieve indicator B, clients are meeting needs and list of barriers is decreased. And for the evaluation, social workers and support groups are provided easily accessible resources for clients and caregivers. Resources will include resources to help overcome obstacles, increase opportunity for socialization for elders during the pandemic. Caregiver mental health resources made easily accessible, expand the hours allowed for respite care for caregivers. The resource list created for caregivers specifically for during the COVID-19 pandemic. Social workers working with family caregivers will provide surveys for clients and caregivers to address obstacles that have been caused due to COVID-19 pandemic and the caregivers' well-being. These surveys will be given at initial contact and continue throughout the case to assess needs and concerns. This project has been very personal for me because I am a family caregiver for my mother. And when COVID-19 hit, the resources for the caregivers and the caregivers' respite and needs, they weren't there. And these resources I've been locating and finding, and I've been searching, and I want to make them more easily accessible and provide this list to other caregivers, because I know there's other caregivers out there who are going through the same thing. And I've seen it on social media and through research, and COVID has affected the elderly population and the medically fragile population drastically. And the caregivers are the ones who are having to put in extra work and extra precautions to keep their family members safe. So we need to support them so they can support their care recipients. And the reason I propose to include social workers in hospitals, hospice, and adult protective services is during all of this, it came to my attention that adult protective services doesn't have any preventative programs. They only intervene when there is elder neglect or abuse or allegations of it. And I think preventative services, by providing the resources and the supports that caregivers need, will help prevent the intervention of adult protective services. So by having them have a resource list as well, and if they're able to give that out to people, then hopefully there will be less elder neglect and abuse and less caregiver burnout.